Beans sound like the most wholesome food on earth until your stomach files a complaint. So what is the honest trade-off here? Are beans and lentils genuinely doing something useful in the body? Or are we just tolerating bloating because plant-based eating has good public relations?
The honest answer is that beans are not magic. They are a dense food package. You get plant protein, intact starch, soluble and insoluble fiber, minerals, and a structure that slows digestion compared with many refined carbohydrates. That combination matters because the body does not experience a bean-like white flour with protein sprinkled in. It arrives as cells, walls, starch granules, and fiber that have to be physically broken down. On the way down, cooking softens the seed, chewing opens it, stomach acid unfolds proteins, and pancreatic enzymes start cutting starch and protein in the small intestine. But some starch and fibers resist complete digestion. That is part of the point. Instead of every carbohydrate becoming glucose quickly, a fraction moves farther along, changing the timing of absorption and the food available to microbes. Then the colon enters the story. Gut microbes ferment certain fibers and oligosaccharides, making short-chain fatty acids and gases like hydrogen and carbon dioxide. The short-chain fatty acids are one reason fermentable fibers are interesting. The gas is why your pants may feel tighter. The same exposure can be metabolically useful and socially inconvenient.
That helps with the bloating story, but viewers also hear scarier claims. Lectins, leaky gut, beans are secretly inflammatory. Is the evidence packet telling us to treat normal cooked beans as a gut threat? Or is that mostly extrapolation from compounds taken out of context?
For outcomes we can measure, lipids are the strongest part of this packet. A 2026 systematic review of randomized trials found that whole dietary pulses at a median dose around 130 grams per day lowered LDL cholesterol by about 0.14 millimoles per liter over a median of 6 weeks. That is not a statin-sized effect, but it is a real food-sized signal.
So if someone eats half a cup of lentils every day, should they expect fewer heart attacks or just a better cholesterol panel? I want the practical takeaway, but I do not want to oversell a biomarker as if it were the same thing as a clinical event.
Exactly. And the way to make the biomarker benefit possible is to avoid quitting in week 1. Start with a few tablespoons, not a giant chili bowl. Rinse canned beans, try lentils or split peas if whole beans feel heavy, and increase every few days. The gut often adapts, but adaptation is not a moral test. Pain, persistent diarrhea, vomiting, or blood are not normal bean initiation symptoms.
What about protein? Beans get praised as protein foods, then criticized because they also contain carbohydrate. If someone is trying to eat less red meat, are beans and lentils a legitimate swap? Or do they need to treat them as a side dish instead of a protein source?
They can absolutely be a legitimate protein-containing anchor, especially in a pattern that reduces red meat. In the My Planet Diet randomized trial, personalized sustainable diet advice increased beans, peas, and lentils, and reduced red meat, while diet quality improved and greenhouse gas emissions fell. The trial did not show short-term changes in body measurements or serum biochemistry, so the benefit there is diet pattern and environmental footprint, not a dramatic 12-week body transformation. The best fit person is not everyone equally. Someone with low fiber intake, frequent refined starches, high LDL, or a meat-heavy pattern has more room to benefit. Someone already eating a high-fiber Mediterranean-style diet may see less dramatic change. And if a person simply adds beans on top of an unchanged calorie surplus, the food is healthy, but the math still matters.
Let's get very practical. If bloating and minerals are the two big friction points, does soaking actually matter? And are canned beans nutritionally inferior, or are they a useful shortcut as long as you rinse them and watch the label?
For most healthy people, minerals in beans are an advantage, but kidney disease changes the conversation, especially if someone has hyperkalemia risk or takes medicines that raise potassium. A 2025 clinical nutrition trial looked at cooking methods and potassium in plant foods for heart disease patients, and lentils responded best when soaking was combined with cooking. That does not create a universal rule. It means potassium-restricted patients need individualized advice.
If someone tries this for a month, what should they measure besides whether they feel gassy? Should they be watching fullness, bowel regularity, LDL at the next lab draw, grocery spending, or whether beans actually displaced something less useful?
Yes, and some people should not force the experiment. Legume allergy, significant swallowing problems, active inflammatory bowel flares, recent gastrointestinal surgery, or a prescribed low-residue diet can change what is safe. People using potassium-restricted plans should not freelance large lentil bowls. And anyone with severe or escalating symptoms should stop the trial and get medical advice rather than trying to toughen their microbiome. My practical version is a bean ladder. Week 1. 2 to 4 tablespoons of rinsed beans or cooked lentils with a meal you already tolerate. Week 2. Move toward a quarter to half cup if symptoms are acceptable. Use them to replace some refined starch or processed meat, not as a punishment food. If it works, the win is boring in the best way. More fiber, useful protein, better diet quality, and possibly a modest LDL nudge.